Okay, so we are having these tutorials as again the gait parameters, the normal gait parameters, what you have learned in theory, now how to measure it and how to assess the patient for the gait parameters. Okay. Now you have learned the different terminologies in the gait parameters. When we are assessing or when we are actually measuring, you should be very clear of where you are keeping the measurement tape or what exactly you are measuring, because it will be asked in the exam and it will be tested on the patients. So these parameters you must be aware of it very clearly. Okay. Now I want one volunteer. The very first thing, regarding about the parameters, the very first thing is the base of support, which is, I am just talking about the normal gait pattern right now. The first thing is the base of support, second thing is the step length, third thing is the stride length, yes, and the fourth thing is the cadence. So all these parameters you should be able to measure properly. Okay. Now I want two volunteers who will be measuring and who will be actually doing it, a normal gait pattern. Anybody from boys, please come fast. You just take out your this shoes, please. Somebody measure it. Okay, come here. You will measure, okay. Take this. Now, suppose now this is your client, just turn on this side, this way. Yeah. Now, whenever it is a normal gait pattern, the very first thing what you have to test is the base of support. For a normal human being in the anatomical position, how we test the base of support is the lateral border of the foot. Just mark the lateral border of the foot, both sides, and the distance between the lateral border of the foot will be the base of support for the particular person. Now just let him measure it, please. Come on. 14.5 inches. Okay. So for this person, the normal base of support is 14.5. Generally it is like that. So there is not much of a variation, but that is the basic of the base of support in the normal standing pattern, and then follow the gait pattern. Now in the gait pattern, as you have learned in the theory, the very first thing we check is a step length. Now step length is, by theory, it is the distance between the end of the heel of one leg to the end of the heel of the other leg. Okay. Now how to measure that, please. Now before I tell him to start the walk pattern, okay, he has to mark the end of the heel, what he takes. The first the right leg or left leg, whatever he starts with. Now generally in the gait cycle, the dominance of the person does matter. If he is a right side person, he will start with the right side, or it can be the left side, but generally 90% of the time it is seen that the dominant leg will follow first. So you have to be aware when you are testing on the patients. Okay. So as he starts walking, just go for one step, just mark his on the end of this heel. Okay, start this step and this step again, other leg step, yeah, no, again wrong, come back fast, come to the end this. Now when he start, okay, when he start, I said don't mark this, you take a one step, wait, mark that step, from there, then the next step you take it, mark that. Correct. Now just move out. Just measure this length in the straight leg, in the straight line, please. Straight line. Straight line. Keep it straight. Straight. Don't keep it in tangles. Take it step. Yeah. How much it is? So that is the normal step length for this person. You got my point? So it is always the end of the heel of one leg, then to the end of the heel of other leg. What generally the mistakes are done is you start from the toes. Don't start from the toes. It is always the step length is from end of the heel of one leg to the end of the heel of the other leg. It is right and left. So that is the normal step length the person has. Now just walk from here with the normal your walking pattern. So generally the step length for a normal person is equal in both the legs. Okay? It does not change much unless there is some abnormality in the fit. Okay? So regarding the step length, everybody is clear? Thank you. Okay, again come again over here. Now regarding the step length we have learned, there is one more parameter we have to test is the stride length. Okay. You have to know the definition. The stride length is the normal distance of one leg at a time, that is the, if he is starting from the right, the end of the heel of right to the end of the heel of the same leg is the stride length. Okay. So it is almost like the double of the step length usually, if there is no other abnormalities. So if we have to start, take one step first, mark that, take the other step and take another step and mark that, correct. Just come out. Now mark this distance to that distance of the leg. So how much it is? 34. 34 is the stride length for his right leg, please note. Okay. Because what happens is many times for a normal person, yes, the stride length will be same. Now here he talked about the stride length of the right side. If he has to measure the stride length of the left side, again please start over here. Now you will measure on the left side. Okay, walk, take one step, mark that and mark it, correct. So this distance will be the stride length for the left leg. Yeah. So it is almost the same, does not make a difference in the normal walking pattern. Now stride length is usually, as you can see, it is almost like a double than the normal than the step length. Now if you observe the patients, many times what happens is one side there is a abnormality. So one side leg or one side pattern might be different than the other side pattern. So there might be the abnormality in the stride length of the left and right. So what you have to be aware of it, you have to measure the stride length on both the limbs, that is the left limb as well as the right limb. It might differ if there is any abnormality. You got my point? Okay, great. Now the third parameter what we have to check is the cadence. Sorry, this is the fourth parameter. First we have talked about the base of support. Second we talked about the step length. The third thing is the stride length. And the fourth thing is the cadence. Now cadence by definition, it is the number of steps per minute. Okay. So you have to walk with the normal pattern for a minute. Okay. Somebody has to manage the time on the mobile, please start the stopwatch. Come here.
Do circles.
Go straight and come back. Just give him a place to just complete the round. Okay. You will count the steps, like how much he is walking for a minute, number of steps per minute. Okay. So when you start the time, let him know. Start. You walk your own normal pattern. Tell him when to stop, okay? After a minute, you stop. Stop. How many? 85. So he was walking a bit slow, I suppose. Because, okay. Because normal cadence is generally 100 to 110 or 120 for the normal persons. It will differ with the each individual. Okay. If there is any, even the psychologically, if person is busy thinking of something, even then his gait pattern changes or even the cadence changes. Okay. So that is the regarding the cadence. Now here what you have to remember is when you are checking it on the patient may not be able to complete 1 minute because of some problems, because of the paralysis, because of some other things. He may not be able to walk till 1 minute. So what you have to do is, don't force the patient to walk 1 full minute because you have to measure the cadence. You can make the patient walk for say 15 seconds if he can, and then if the patient want to stop, you can make him sit somewhere and then you can just multiply it by 4. So 15 seconds into 4 is 1 minute, and you can measure, you can just measure it as a cadence. Is that clear? Yes. So these are the 4 basic parameters of the normal gait cycle, which you have to know, because whenever we will be assessing on the patients, you have to be ready with your instruments so that you do not have to make the patient wait for your calculations. So now we talked about the base of support of the normal gait pattern. So whenever the patient has a problem of balance, now naturally with that much base of support, maybe he is not able to balance himself. So there are always the chances that he will fall. Now for such patients, the different type of mobility aids as a therapist you will be prescribing, and for that mobility aids you will be also training the patient. Now here in the theory we talked about the different mobility aids as walker. There are crutches which you can prescribe. The different type of crutches we have talked about, that is the auxiliary crutches and the elbow crutches. Okay. Another mobility aid you can prescribe is a cane. Every mobility aid gives the broader base of support for the patient so that he can balance himself better. So now the base of support will increase. How it will increase and what are the patterns of walking with the mobility aid is important for you to know. Now there are the type of training which we give, particularly with the auxiliary crutches. Now when the patient we prescribe the auxiliary crutches, we have to also train them regarding that. So I want one volunteer just with the auxiliary crutches, please. Just take those auxiliary crutches. Please come here. Just hold auxiliary crutches. Okay, so these are the auxiliary crutches. Please note, whenever you are giving the auxiliary crutches to the patient, it has to match his size. Now for that, this is the auxiliary pad, then these are the hand units, and then there is a bush downwards which don't allow the patient to fall. Okay. Now just see when he is holding the auxiliary crutches or the patient is holding the auxiliary crutches, what is the base of support over here is, that is the lateral border of the crutch on this side and the lateral border of the crutch on this side. That means the base of support has increased. Naturally, there are chances, less chances of the patient or the person to fall down. So that is why the importance of auxiliary crutches or any type of mobility aid is increase the base of support and allow the patient to walk within that base of support if he has the support on bilateral side or on the unilateral side, that is on one side, it is always comfortable for the patient. So as you have seen, the base of support is increased. Now how will you train the patient with the auxiliary crutches? Now there are the patterns which we have to follow regarding the training of the auxiliary crutches for the patients. Now there are different type of gaits with the auxiliary crutch patterns. Please remember, the very first thing pattern is the 4-point gait. So for the 4-point gait, 4 points you remember, one is the crutch, then the right leg is second point, third is the left leg is third point, and this side crutch is the fourth point. When we are training the patient or training the person, one crutch will go forward, then opposite leg will go forward, then this side crutch will go forward and that side leg will come in forward. Okay. Now why I am telling is the right leg or the right crutch with the left leg, after that is the normal gait pattern of the shoulder and the pelvic, which goes on the alternative patterns. Okay. So shoulder girdle and pelvic girdle have always the alternative pattern in the normal gait cycle. So whenever you are training the person, always tell the person to take the crutch, one crutch first, opposite leg, that is the second point, third point and then the fourth. Again 1, 2, 3, 4. 1, 2, 3, 4. Thank you. Wait over here. Okay. So this is the 4-point gait. Everybody has understood? Yes. Okay. So this is how we are training the person who have the balance problem, maybe the geriatric people who are more comfortable with this type of walking pattern, because it is a slow type of walking pattern. Also there is one more pattern which is called as a 2-point gait. Now what is a 2-point gait is, the crutch on this side, the right side and the leg on that side goes together forward and that becomes a 1 point, whereas opposite leg and the opposite crutch goes together in front, that becomes the 2nd point. That means the crutch and one leg will go together as a 1 point. Okay, just come here. Okay, if whenever you are training, now this crutch and this leg forward, yes, and then that leg and this crutch will come forward. Again, so that is 1 point and that is 2 point. Okay, again 1 point and 2 point, correct. 1 point and 2 point. So this is also a type of walking pattern. Thank you. That's good. This is also the type of walking pattern we teach the person. Whatever the pattern he adopts, it is better for or comfortable to him, the person adopts. Okay. But always check that you go with the normal walking pattern, that means the shoulder girdle and pelvic girdle movements, opposite movements are carrying forward together. That means he will be within the normal walking pattern. That means the energy conservation with the patient is much better than the opposite thing. So, these are the 2 points or the point crutches patterns. Now, very third pattern is also there for the auxiliary crutches, that is a 3-point gait. Now, what are the 3 points? The 3 points is again 2 points of the 2 crutches and also 1 point is of the 1 leg. Now, that happens when if the person has an amputation, that is the cut of the limb, and person has only 1 limb for him to walk. So, that becomes a 3 point, or maybe after the fracture of the lower limbs, the doctors advise him for the non-weight bearing, that is do not bear the weight on the particular limb. When that happens, the limb has to be put in the air, it should not be touching the ground. That means the weight bearing should not come on that limb, it is called as a non-weight bearing pattern of walking. When such things are there, you have to train the person with the auxiliary crutches, which is called as a 3-point gait. Okay. Now, in the 3-point gait also there are, it is like for the person to be comfortable first, the person walks with the 2, that is one thing is a swing 2 gait. We train the patient with the swing 2 gait. When he is comfortable, he can go through the swing through gait. Now, what is a swing 2 gait and a swing through gait, that I will demonstrate. Just come here. Now, again for your explanation, 1 point is 1 crutch forward. Now, this is the next point, that is the 2 points, one leg in the air, yes, and what he is doing is a coming in line with the crutch, that is the 3-point gait, swing 2 gait. What he is doing is right, 1 crutch forward, then second crutch, and he is coming in line with the crutch, and this is called as a 3-point gait, swing 2 pattern. What he is showing is, because he cannot, he is advised by the doctor or the person is advised by the doctor not to bear weight on that limb, he is walking with the swing 2 gait, 1, 2 and 3, 1, 2 and 3. Okay. Is it clear? Thank you. Wait. Is it clear? When the leg comes in line with the crutches, it is called as a swing 2 gait, and that is what we will train the patient initially before he gets adjusted to the crutches, because the patients like amputation where the 1 limb is cut, they have to permanently walk with the crutches, and so they adopt the pattern accordingly. And we have to see the comfortable, how patient is comfortable or how well he adopts to the walking pattern and to the crutches. Now, as I said, another pattern in this is a swing through pattern, that is basically seen or the patient adopts himself to that pattern, or if whenever he is comfortable with that pattern, he can go through that pattern. Just come here. Now, in the swing through gait, the thing is many times 1 crutch forward, the other crutch forward, and go through the more beyond that. Just 1, 2, go more beyond. So, he is going more than the border of the crutches, that is he is swinging through the line. This is a more faster walking pattern, what he is showing. Come here. This is the more faster pattern what the patient is showing, or it is easier for him to walk faster. When he is passing, his leg is passing through the border of the crutches forward, it is called as a swing through gait. If it is within the border of the crutches, his leg is within the border of the crutches, it is called as a swing to gait. And these are the patterns with the 3-point gait the patient is showing. 3-point gait, why I am telling you is, the other leg is not touching the ground, it is either it is in the non-weight bearing pattern, or as I said, the patients who have amputation of that limb, they generally we have to treat the patient or we have to train the patient in particular pattern. Okay. So, this is thank you. So, this is regarding the auxiliary crutch patterns, which as a therapist you have to train the patients. First of all, check his parameters, what is his normal parameters which we have already talked about, that is the base of support, then the step length, stride length and the cadence. For that particular person, if you know all the parameters, it is easier for you to train the person. You are giving the mobility aids to the person to increase his base of support. The type of crutches is your choice, what type of crutches you are giving. But today we have learned about the normal, the patterns you will treat the patient for the auxiliary crutch patterns, that is the point gait patterns. Now again 3 types, that is the 4-point gait pattern, 2-point gait pattern, 3-point is swing to and swing through. Okay. So, these are the walking patterns we have to train the patient as a therapist for the with the mobility aids.